despite England hitting their vaccine target, an exclusive Good Morning Britain survey of 100 care homes in England found that 68 of them had at least one staff member who refuses to take the coronavirus vaccine. Of the 68 homes with refusals, 38% of the care homes said they were told fertility concerns were the reasoning behind it. In 31%, it was fears over safety and side effects. 6% of the concern came from the BAME community. Also discovered that 7% of the homes had less than 70% uptake amongst staff. Well, here's what Chief Medical Officer Chris Whitty said about this subject in last night's press conference.
It is a professional responsibility for doctors to do things which help protect their patients, and I expect that to be a professional responsibility for all other health and social care staff as well. The professional expectation, very strongly, my view is professional medical and social care staff should be taking it.
Well, we're joined now by Pete Cavalier, who runs care home operator Barchester Healthcare, and also care home manager Adam Purnell. And you two have very different views on how far you'll go in insisting on whether your care staff should get the vaccine. Adam Purnell, let's begin with you. You are the care lead at Keppelgate Care Home. You are concerned, aren't you, that if you insist that staff have the vaccine, you will simply lose staff at a time when recruitment in the care sector is so hard?
Oh, completely. I mean, we're quite lucky. We've had a really high uptake of staff having the vaccine at our home. But I reassured them that if they didn't, their jobs wouldn't be in jeopardy. I mean, recruiting in health and social care is one of the most difficult things we have. You know, we're underpaid, we're underfunded, we're undervalued. We're struggling to get people through the door to come and want to work in health and social care during a worldwide pandemic. So if we start enforcing and mandating vaccines on top of that, we're just going to limit the amount of people that are going to want to come in and work for us.
Sorry, but I mean, with the greatest will in the world, if you're going to, if basically financial imperative and staffing issues are your deciding factor about whether to let people care for the oldest, most vulnerable people in the country who don't want to have a vaccine to protect not just themselves, but from to protect the elderly people that they're in charge of. If I had an elderly relative in a care home and I knew the person caring for them was refusing to have the vaccine, I wouldn't want that.
I mean, you know, you're more than welcome to come and apply for a job, Piers, if you want, because we're going to need people to work in social care. I mean,
no, I want people to work in social care, but I don't want them to refuse the vaccine.
That they're not supposed to have. I'm not telling people to refuse the vaccine. What I'm saying is, if we automatically, in the next month or two, go, right, everyone needs to have the vaccine, social care is going to be in a much dangerous position than it currently is now, because there won't be the people to work.
Well, unless, as Professor Whitty said, they actually see it as a responsibility and part of the job, which I think if you're in social care or working in the NHS, I'm sorry, you should feel a responsibility and duty of care to you, the people you're caring for.
And if that's going to be the case, maybe there should be a better informative schedule for people to learn from. You know, I think we should be mandating vaccine training awareness in places. We need a better line of information to provide people.
OK, well, Pete Cavalier, you take a different view. You're Chief Executive of Barchester Healthcare, and you are saying no jab means your care workers will no longer have a job. I mean, what is the rate of uptake? What are the reasons people might be refusing? And what are you going to do if those care workers say, actually, we don't want to be vaccinated?
So there's a lot of... good morning, everyone. Yes, at the moment, we obviously spend a lot of time consulting with our staff, looking at the national and international evidence on the effectiveness, the safety, and hopefully, more recently, that it reduces transmission. We've recruited an independent expert, Professor Nicholas Stonehouse of Leeds University, who's a professor of molecular virology, to support our thinking, because we look after the most vulnerable people in society. Prof. Whitty had it absolutely spot on. It's a professional duty for doctors and I believe care workers to do their utmost to keep the vulnerable residents and their colleagues and their families safe. So we believe we've taken a considered view about this. We've consulted with our staff, we've written emails, letters, we've had one-to-ones with the staff who've decided or haven't decided yet or actually decided to decline.
And how many staff do you think you may lose as a result of this new policy?
Well, so currently the policy is that as from the mid-January, any new recruit had to agree to have the vaccine or had to have had the vaccine. We have now served notice on yesterday that in 2 months' time, we're serving 2 months' notice that if someone hasn't had the vaccine by then we can't offer them shifts. But in the meantime, we're going to review every 2 weeks any new evidence on safety, effectiveness, transmissibility. But that's where we are. In terms of vaccinations, currently 91% of our residents, and we have just under 12,000 residents, and 83% of our staff have had the vaccine already, and we have around 17,000 staff. People who are either 2% of our staff have been agreed that they're exempt on medical grounds, and there is currently 5% of staff who are declining.
So you may lose, and how many is that in total, 5%?
Well, that'll be around 1,000 staff.
Wow.
Yeah, but
That's
you know
a lot
what?
of people to lose, isn't
I think,
it?
honestly, I'm sorry to sound harsh, I think they're in the wrong job. If you're in the job of caring for the oldest, most vulnerable people in the country, and you simply don't want to take a jab to protect them, you're in the wrong job. That's not what I call care. Anyway, look, we've got to leave it there. Thank you both very much indeed. We appreciate it. And we appreciate all the efforts, by the way, of everyone in the care business, because it's been a very, very tough year. So regardless of this debate, thank you for all the work that you guys have been doing, and all your staff in particular for the great work they've done in the last year. It's greatly appreciated.